the weekend.
Rhode Island's Lieutenant Governor Sabina Matos says she has tested positive for COVID-19. Matos, who is vaccinated and boosted, says she's experiencing very few symptoms. 12 News reporter Anita Buffoni joins us now live in studio with those details. Anita?
Well, Kim, last Tuesday is when the Lieutenant Governor and Governor were together. According to Dan McKee's office, Matos tested positive yesterday, but given the CDC guidance, Governor McKee will not have to quarantine. Lieutenant Governor Sabina Matos took to Twitter Tuesday, revealing she has tested positive for COVID-19, both vaccinated and boosted. Matos says she is not experiencing severe symptoms and will stay in contact with her office virtually until her quarantine ends. As for Governor Dan McKee, he does not need to quarantine because of current CDC guidance, according to his office, and he tested negative Christmas Eve. For those with COVID-19, new CDC guidance cuts the isolation time to 5 days after a positive test, down from 10 days. But with the delay in PCR testing and at-home tests hard to come by, one top ER doctor says to assume you're positive until you get tested.
Stay home for that 5-day period, knowing that if you can get a PCR, it's going to be 5 days before you get a result.
Dr. Rainey credits COVID testing to be accurate, with the caveat they are accurate at the moment they are administered.
One of the things about Omicron is it has a shorter incubation period than prior variants, so it's possible for you to be negative in the morning and then turn positive at night. I sometimes make the analogy that it's like a pregnancy test.
The CDC says isolation begins the moment you test positive. They recommend you leave isolation after 5 days and no symptoms. If you have symptoms after those 5 days, you should stay home. And with positive case numbers hitting record highs in Rhode Island, the state announced more community vaccination clinics will be opening up tomorrow. We have those details listed on our website at WPRI.com. I'm Anita Buffoni, 12 News.
And Rhode Island Lieutenant Governor Sabina Matos has now tested positive for COVID-19.
Her office says she tested positive yesterday, and in a tweet this afternoon, she said she has very few symptoms and says she believes that's because she's fully vaccinated and got the booster.
Now the question tonight, does this mean that Governor Dan McKee needs to quarantine since the two are often together? 12 News reporter Anita Buffoni joins us now with the answer. Anita?
Well, Shannon and Kim, it's been 7 days since Governor Dan McKee and Lieutenant Governor Sabina Matos have been together. And because McKee is also vaccinated and boosted, CDC guidance says he does not need to quarantine. Rhode Island Lieutenant Governor Sabina Matos says she is experiencing very few symptoms after contracting COVID-19. In a tweet Tuesday, Matos, who is vaccinated and boosted, says she will be in touch with her office virtually until her quarantine is over.
I'll turn it over to our Lieutenant Governor.
The pair often shoulder to shoulder. Governor Dan McKee, who doesn't have symptoms,
Thank you, Governor,
is not required to quarantine under current guidelines, according to McKee's spokesperson. The updated guidance says you should go into isolation for 5 days after a positive test, down from 10 days. Isolation begins when you test positive. If you have symptoms after those 5 days, you should stay home. These guidelines are for everyone, vaccinated and unvaccinated.
I'm not sure why they included the unvaccinated in these recommendations.
Dr. Megan Rainey, an emergency physician with Brown University's School of Public Health, says the move is a step in the right direction, but questions why everyone was grouped together.
I would have far preferred to see one of two things. Either to see this guidance only apply to the vaccinated, for whom there is much stronger data that we're not infectious after 5 days, or to require a negative test before people go back out.
Now, the CDC made this change after evidence found people with coronavirus are most infectious, 2 days before and 3 days after symptoms develop. I'm Anita Buffoni, 12 News.